You guys remember in the last episode, I was talking about a procedure that I had done that I would be bringing on my injector and the rep of the company to talk about. And today is the day they are on. And I'm going to tell you all of the juice on my procedure that I had, which was the Easy Gel procedure. And today I have Renee Arriaga, who's a longtime aesthetic nurse injector, and Nicole Tribe, who is from Greater Houston Aesthetics, and she's the rep for Cosmo France, who's the brand for Easy Gel. Hi, ladies.
Hi, morning. Hi, Mavi.
I am ready to tell my girls, my audience, everything about Easy Gel. They know I've been on the hunt for something that I wanted to do to rejuvenate my face, that I was even thinking about maybe a mini facelift, something. I don't know. So let's start by introducing you guys and really going into detail about who you are and what you do. So Renee, tell us a little bit about yourself.
All right. Thank you. Thank you for having me. I'm Renee Arriaga, and I've been a nurse injector for 18 years. And I got into plastic surgery first. I learned lots of great stuff. And then I just developed so much that I could be a trainer for different companies. And I love Easy Gel PRF. It's been one of my greatest assets so far.
And Renee, you guys, she's not a bragger, but she should really brag about herself because she's an amazing injector. She has a very natural look to her fillers, and which is something that I love. I want to look like myself just, 10 years ago. Okay, so now Nicole, tell us a little about yourself.
Hi, good morning. My name is Nicole Tribe, and I have been working with Cosmo France for a little over 8 years. And Cosmo France developed PRF, the rich fibrin, or Easy PRF. And now in the last 2 years, they launched a new product called Easy Gel. Platelet-rich fibrin has been around for decades, but it just wasn't in the aesthetic space. So it's really nice to kind of work with something that's 100% all natural and, kind of see the evolution of things that we can do aesthetically on our skin to rejuvenate.
Let's start from the beginning. What are the different uses for Easy Gel?
Easy Gel is, first of all, is platelet-rich fibrin. And platelet-rich fibrin is 100% all you. It's 100% autologous. The way that we get the PRF is we draw your blood, we spin it down. There is nothing in the tube. So it's 100% just all you. And then we spin it and extract the growth factors, platelets. It's leukocyte rich, which helps with wound healing. And there's a percentage of mesenchymal stem cells. So if you can imagine, this PRF is this hyper goodness of all these great cells that we reintroduce aesthetically. PRF is used for rejuvenating facial texture, skin texture. You can use it for hair regrowth. You can inject it for different areas for scar treatments and stretch marks. So PRF alone has so many great applications. And now we have what's called Easy Gel. And Easy Gel is just another process of using our PRF, but we also extract the patient's albumin. And the albumin, we take it through a process of heating and thickening it, and then we mix in the PRF, and it's floating in the patient's albumin. It's still 100% all you, which is amazing because your body instantly recognizes it, and it goes straight to work. So when you do a treatment like Easy Gel, like you did, for instance, under the eye area, it's a very, very effective way to kind of put in all of those great cells to kind of regenerate that tissue under your eyes. That's why you get, new skin proliferation, new collagen, elastin, fibrin, and you get this like beautiful glow. And it's because you're volumizing that area that has slowly aged through time. but you're also thickening the dermis, plumping it up, and just really kind of creating, restoring your facial fat pads and kind of getting everything back to, turning back the clock, which is everything we're looking to do.
Exactly. So let me tell you guys a little bit about my experience with it. So first I had my man do it, and because I had a big event, I knew I was going to get swollen. So I couldn't do it around. So I had him go first. And as I'm watching the results on him, I'm getting more and more jealous. I need to go do mine right now. I could see the glow in his cheeks. I could see just the brightness underneath his eyes. The texture of his skin just looked so much better. And now, after having my procedure, first, if you have this procedure done and you swell, do not get scared. Roll a clip. Let's put the video of me the next day after my procedure. And I scared myself in the mirror. I was so swollen. Why do you get so swollen?
So it's that inflammatory response. And Renee, you can probably talk about it a little more in depth, but it's basically we want that inflammatory response, right? Your body's reacting to all of this. So I tell everyone, expect swelling. Some will swell more than others, but it's a good thing.
It's a good thing. We get it. No ice. No freaking out. Just know that you could swell. Definitely, if you did it in the afternoon and you've slept all night and then you get up in the morning, I noticed it was the most at that time. I know for me, it stopped around 11. I could tell it was going the opposite direction, and it just down, 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 and just a little on the second and the third day. It's not a big deal.
Yeah, my swelling was the worst that morning, the next day, and it got better throughout the day. But what made me laugh was my cheeks were so swollen, like I could see the bottom of my cheek through my peripheral vision, because my cheeks got so big. But I love the results so far. And I was really interested in hearing about what you mentioned to me during the treatment, Nicole, which was the studies of how the skin or how it is underneath week by week or what's happening.
It's a biostimulator. Easy Gel PRF is a biostimulator. So there's a lot going on underneath. And when you deposit those good cells in that area, your body's responding to it. And it takes a little while, right? You don't instantly create collagen and elastin and fibrin. So your body kind of goes through this process, but it's a process of rejuvenating. So you kind of go through the stage where, you get this immediate, kind of response where some will swell. And then it kind of settles in. And then a couple of weeks go by. And that's when you really start seeing that collagen proliferation. And it's almost like you forget about your treatment and you look in the mirror, or someone says something to you and they're like, God, you look really great. You look really rested. And then you look in the mirror and you're like, oh my God, I get it now. Like that collagen has started forming. And it's one of those things because you really get excited for your next treatment. And with PRF and Easy Gel, it's something that you do want to do a treatment series because you want to create that collagen cascade, that collagen formation that I was talking about, where all of a sudden you see this glow up. When you do your second treatment, it snowballs on itself and it gets even better and stronger. And that volumization restoration lasts longer. Your results keep improving.
I love it. And what is the spacing between the treatments, or what does a treatment series look like?
Ideal treatment series is going to be 3 treatments. First 2 treatments, space them 6 weeks apart. And then that third treatment, depending on the case, depending on the areas that you're working towards correction, that one can be anywhere from, 2 to 3 months post that second treatment. And then maybe a year and a half maintenance, one treatment a year to a year and a half later, right? To keep that stimulation going.
Okay. You know what I really loved that I saw on my results was the brightness underneath my eyes, because that was something that I was battling with. Like, it's starting to bother me. I'm starting to see the volume loss underneath my eyes and also some shadowing, some darkness. And I noticed that it's a lot lighter. Why did that happen?
So one of the things that's happening is when you're depositing those good cells, you're actually bringing blood flow to the area, right? So there's a lot of things going on. You're bringing blood flows, so it's kind of, fleshing out the area. You're also creating new, fresh skin. And the new, fresh skin a lot of times doesn't have the mutated melanocytes, right? The melanocytes which create darker pigment. And so you're getting this new, fresh bank of skin that isn't mutated in any way. And so it just kind of helps diffuse everything.
I love it. One question I have, because I know a lot of my listeners are currently doing filler. I know I have a lot of listeners who want to do filler, but they don't want to do anything foreign. They don't want anything foreign in their body. And I found that the procedure of Easy Gel, how many syringes, Renee, did we get out of my...
5. Usually we should get 5. A person needs to be hydrated, and then we should get 5. So going into the procedure, say 2 or 3 days, we want you to drink a lot of water so that when we draw your blood and spin it down, our goal is to get 5 cc's of your own body to put back as PRF.
A lot of people are calling this natural filler. I know it is kind of a natural filler, but it's different because filler, stays for however long, 9 to 12 months, 6 months, but then it goes away. So how does this compare to filler?
Easy Gel is similar to filler, but then at the same time, very, very different. So filler is just going to fill a void, right? A hollow. And it's a foreign substance. There's many times where filler is actually, very beneficial and needed, depending on what the patient's goals are. Where Easy Gel is different is it's going to volumize the area. Easy Gel you can use in multiple areas of the face and body, but it's going to volumize in the sense that it is rejuvenating the skin. It's plumping skin. It's creating new skin. It's not just filling a void. It's actually regenerating that tissue. And so that's how you get that natural volume restoration. So I say that it's similar to filler, but it's actually multifaceted. It's doing so much more. And in an area where under eyes are, a sensitive area to treat, a very delicate area for fillers to treat, Easy Gel sometimes is a great option because you don't have the risk of accidentally putting it in the wrong placement where you can create a tindling effect. It's not hydrophilic, so it's not going to bring excess water to the area, and you don't risk any kind of filler migration. So in a sense, it's a very, very, especially for patients that want 100% natural treatment, it's a very great alternative to filler. But I've seen it used in conjunction to filler. There's times where filler is definitely necessary and needed. So it's kind of dependent on the patient's case and their goals.
What she means by that is, like, as a patient, if you're looking for volumizing, for example, all throughout your cheeks or your lower face, it's a good option. Or I guess if you're looking to build structure with some thicker filler, this wouldn't be the right alternative.
From an injector standpoint, I couldn't wait to get settled in my business so I could buy the system. In actuality, I was kind of buying it for me. It's a little selfish, right? But I wanted to see how it worked because I knew as I was getting older, I was getting volume loss under there, and I did not want filler. Filler is made in a lab, whereas Easy Gel PRF is your own body, as Nicole has said. And it is just worry-free. It's easy as can be. You don't have to worry about it. You don't have to worry about it being dissolved or needing to be dissolved because you didn't like it. As an injector with filler, you have to do it like exactly symmetrical and even. You really have to be an artist in the way the placement occurs. But with Easy Gel PRF, you can just eye it, put it in there. You just want it in there so that fibrin clot can work under the skin and attract your own stem cells. So the stem cells rejuvenate the skin and create new blood vessels, as Nicole said.
I love it.
I love it too. I just didn't want any filler. I didn't want any round and round about what if too much water's under my eyes or anything, and I don't have to worry about it at all. So I love using it for my patients.
Can you go a little bit into the difference of PRF and PRP?
So PRP is platelet-rich plasma. It's been around for a while in aesthetics, and it's a really great treatment. The way it's created is similar. They'll draw the patient's blood, spin it at a very fast centrifugation, and the two usually have an anticoagulant. Sometimes they have an additive, but it's basically spinning at a very fast centrifugation, and you get your platelet-rich plasma. You extract that and use it aesthetically. PRF, platelet-rich fibrin, you draw the patient's blood. There is nothing in the tube. So like I said earlier, it's 100% all natural, all the patient, and you spin at a slow centrifugation. By spinning at a slow centrifugation and not having anything in the tube, the blood component creates what we call a fibrin matrix. So if you can imagine like a microscopic sponge and it's spinning slowly, so that sponge is gathering this crazy concentrate of all the good cells. And so that's where you get, a percentage of mesenchymal stem cells. It's leukocyte rich because you're spinning slowly. A lot of times with PRP, when you're spinning so quick, a lot of the good cells get pushed down to the bottom of the tube, so we don't have access to them. So with PRF, you get this potent concentrate of all these good cells, and they're kind of floating and living in vivo in this fibrin matrix. PRP is what we call a quick release. Those great cells are going to be, they're going to go immediately to work, and then in, 8 to 12 hours, it's going to be done. PRF is a slow release. So as the body's healing, as it needs those cells, it's releasing those cells. So you'll see, a release of cells from anywhere from, 5 to 10 days versus just a few hours.
For somebody who is considering an easy gel treatment, what are some tips that you guys, maybe one each, can go and give our girls a tip on finding a good provider and what to expect?
Well, definitely, as we said before, drink a lot of water so you'll make a lot of PRF that we can use. Whereas Josh, we got to get his water levels up. It's Mavi.
And beat him.
Water like.
Oh, you guys, me and Renee know each other for years, lots of years. So she knows me, and I love me some water. So when I went in there, he went first. And how many syringes did he get? I think
he was a whole cc to a cc and a half short. Okay.
Yeah.
So I was like, dude, you need to drink some water.
I turned it into a competition. I was like, let me see how many you get, how many I get. I got 5.
Yeah, you got more than 5.
Yeah, I did good.
He tried to step it up the second time, but he was still a little behind, Yeah, I don't think anybody can drink water like Mavi except Camel or something.
There are a few things that you can do to kind of optimize your PRF production. Like Renee said, hydration is huge. It's key. It's going to be a direct correlation with how much you yield. But also, I tell providers to kind of, put a treatment plan for their patients where, they encourage them to have, eat a clean diet, high protein, reducing the fried foods and the extra fats. The more you can do, take your supplements, that's super important. Clean diet. For those that are a hard stick where it's very hard to get blood from, I encourage them to, maybe exercise before they come in, get their blood flow going. Anything you can do to help, kind of bring health to your body at least 2 weeks before your treatment, the better your PRF will be.
you also need to find a good provider that can draw blood in their sleep. Okay, like that's good.
Yeah.
Okay, that's a good thing.
Renee was an ICU nurse before she ended in aesthetics, and I've seen her poke things that you can't even see or feel.
Drawing the blood is the hardest part. Everything else is easy.
And I'm not sure how much real everyday life experience aesthetic, folks get in drawing blood. So this is a new skill for them, maybe.
If you are in the Houston area and you want to go see Renee, the one who did my treatment, she is offering a $50 off your treatment discount. I'm going to add the link and her phone number to the podcast description. And if you are not in the Houston area and you would like to find a provider, you can reach out to Nicole, and Nicole will help you find a provider in your area. So this procedure and this treatment is offered nationwide. However, they don't have a provider locator, right?
Yeah, correct. So yes, you can reach out to me via Instagram. You can DM me, and I can help you find a provider in your area that does PRF and ECGel.
And you ladies know this show is about plastic surgery, and you both have had some surgery. If you have a tip for our listeners, I always like to ask my guests tips for my audience of if you are talking to your sister or your best friend and she's thinking about having surgery, what is one tip that you would give her?
I always tell my patients, go with the provider who you feel the most peace in your heart over, okay? Go and interview 3 providers, and you make sure that they're going to be there for you before, not just before and during, but after is one of the most important points in the game, that you want them dedicated to you and your care, whether it's easy or complex. You got to be for sure.
That's a good tip.
Yeah, I'd have to second that. That's exactly what I was going to say. Do your research. Don't be afraid to ask questions, because what's important to you may be different than what's important to another patient. And it's going to find a provider that talks to you and answers all those questions. Go see at least 3 providers and pick the one that you feel comfortable with that really gives you a treatment plan before and after. Because a lot of times, if they don't really kind of leave the after in the dark, and that's when you need them the most. And that's when, random things are going to pop up that you're not sure how to handle. And it's great to know, just having that peace of mind that you can send a quick text or send someone a quick message and they can reply, fairly quickly and say, that's okay, that's normal, this is the process. Or, how about you come in tomorrow and see me and we'll check it out. Just that psychological peace of mind is huge.
Oh my God, that's such a good point. Right, Renee?
I would definitely add to that if you're in your consultation and they're trying to change your words, or no, I don't think so, or, they're hurried or rushed, or they don't have time for you, watch their interaction with their staff.
Yes.
All those things are so important, to have your eyes open and pay attention to detail, because this is a detail that's going to really make or break your experience and your recovery. Ask if they have a nurse that'll come to your house. Those kind of things. Very important to be safe. Just doing research, but it's so important.
It is. It's a crucial part of the journey. I talk about it, I think, almost every episode. Make sure you're doing your research. Make sure you're following your gut feeling. If your gut's telling you something's wrong, something doesn't feel right, it probably is wrong. Maybe something is right.
That way. That's right. If you feel that way, just cancel. It doesn't matter. They work for you. That's so important. Your doctor works for you.
Your plastic surgeon works for you. Exactly.
A lot of times people just go into it like, oh, I'm going to have surgery. I'm going to get some boobs, or I'm going to do whatever. It's like, it's still major surgery. You're still going under general anesthesia. This is like imperative that you're not just, woohoo, whatever. You've got to be serious, because it could cost you.
the support that you give women, like you creating that network is so important. Like I've been so happy having the opportunity to meet you because I met you right at the time that I was like, oh my God, I'm going to have a surgery. I don't know who to go to. And you had such great information and really kind of helped me set a course. And that was huge. Otherwise, I would have, because there were a lot of times where, I was calling providers and they were like, okay, well, I can see you in 3 months. And I was like, 3 months? Oh my gosh, I've got a situation at hand where I need to get it addressed quickly. And so thank you.
Thank you, Nicole. I tried my best. Renee knows she was with me when we came up with this, idea of women needing more and more support. And I'm so thankful to have my network and to have my team, to have my platform. I'm so thankful because I receive messages like yours every day of, thank you for being my hype girl remotely. I live on the other side of the world, but you pushed me and I went and I had my surgery and now I'm so happy and I can't believe I didn't do this sooner. So those messages and those types of stories keep me going.
Well, definitely. Yeah, Mommy, I think that when you say pushed you, I think that you love and support and both of us truly love and care for our patients and we're honest with them. That's the number one thing.
Absolutely. Absolutely.
And you can feel the genuine care that we both have for our patients.
Absolutely.
For a long time.
Renee and I worked together and we saw patients together. I helped her build her practice, her injector practice. When I met her, she told me, next year I want to take more time off and make more money. And I was like, okay, let's do it. The next year she took 3 months off and we made, that next year that we worked together, you took 3 months off and you made more than you made the year before. So
you know why? It's only because of synergy, really.
Yeah.
It's synergy. It's common goals that just work to build. And those vacations, they weren't just vacations, they were great missions trip and all kind of things that were so beneficial and amazing. So thank you, Mavi, for helping me to make that happen.
You're welcome. Love you. So thank you guys so much for being on the show. I'm so happy to have you both on and talk about Easy Gel and about platelet-rich fibrin and PRP and giving our girls the scoop on what's new out there. And there's so much technology evolving everywhere in every industry. And I feel like this is something that's evolving in our industry. And I see so many providers jumping on board with Easy Gel and offering it every day. I know there's some places here in Houston that they're doing a lot of Easy Gel, right, Nicole?
Yes. No, I would add to that it's really cool and exciting to see everything in aesthetics is kind of moving towards regenerative aesthetics. So you doing treatments that trigger your own body to heal and rejuvenate and regenerate, like that's the key. And I think that that's why we're starting to kind of get this shift of really seeing like patients getting these beautiful natural results where they look like themselves, right? They're not looking like, a cookie cutter, look that we're kind of moving away from. Is all about regenerating your natural beauty and just kind of gently turning back the clock. And I think that's what keeps me going every day. I love Easy Gel. I love PRF and all of the biostimulators. It's safe and it's a great treatment that, keeps us looking, beautiful and youthful.
Beautiful and youthful. And I like to call it the natural filler for my girls out there, my crunchy girls who don't want nothing foreign. This is your natural filler option. And let's also talk a little bit about cost. I know it's going to vary, right, across the country, but what's the average cost of a treatment of Easy Gel? And then I'm going to compare it to, for example, in my case, when I got 5 syringes of my own natural filler, what would the equivalent cost of that have been for me if I had had normal filler?
On average, I would say an average treatment, one treatment of Easy Gel, which of course you want to do it in a series, is anywhere from, 13 to 1500 per treatment. So an average treatment series is going to be, in the, $3,000 to $4,000 range. But it's going to, like you said, yield you at least 4 to 5 syringes of your PRF gel, your Easy Gel, that you can use to treat multiple areas versus like one syringe of filler that's usually 1 ml can only treat so much. With Easy Gel, you really do have the opportunity to have like an abundance of really great material to put in multiple areas.
So the 5 syringes that I had, if we averaged them at $700 a syringe, it would be about $35. And that
is time.
one
right?
time, one time. And also it'll be gone in 9 to 12 months. So this is not a little bit different, a lot different in my opinion.
And it's something that will build over time. So you will keep, regenerating and it will keep improving. So you'll just keep looking better as months and months go by as you do your treatment series.
Not just using a drop in the bucket like filler, but you're actually getting that long-term rejuvenation, and regeneration is the key word.
Right.
Ooh, I like it. Regeneration. Let's regenerate my whole face. Let's do my whole body. All right, guys. Thank you so much for being on the show. I'm so happy to have you guys on, and I will see y'all next week. So if you're listening to this episode and you're listening to the Big Butts No Lies podcast, you might be on your surgery journey. And if you are, and you don't know what to do, you don't know where to start, you've come to the right place. I am so excited to do one-on-ones with you guys. I've realized as I do them more and more just how valuable they are to you, not only because you get my expert opinion, I get to guide you towards plastic surgeons that we know are going to do a good job and keep you safe. Besides all that, I get to talk to you about things that might not even be on your radar, things that you don't even know are possible. But since we get so in depth with our conversations and I really get to know what your dreams are and what you're really looking for with your body, I can tailor my recommendations to the surgeons that I know can help you achieve that. And taking the guesswork out of who to go to is invaluable. So schedule your one-on-one phone call with me. You can go to my website, go to the quick links, submit your information, let me get to know you. Let me see how can we help you. You can get your own team. You guys, I have been working so hard behind the scenes to come up with a perfect way for you to have your plastic surgery and not only come out with beautiful incisions, but also feeling beautiful on the inside. So book your call with me and take the guesswork out of your plastic surgery journey. And don't forget, new episodes every Monday. I'll see you then.